So I'd like to hear one or two things that somebody who was a teacher for round 2 said, I'm taking that and I'm definitely using that thing when I'm teaching during round 2. What techniques worked really well to make this happen?
Just one quick thing. Don't break up the Lego pieces yet, please.
And if you did, it's okay. Okay. What things worked really well? Go ahead.
Sorry, I'm quiet anyway. Defining that we were starting from the bottom of the structure and working up. With it being Legos, that's pretty obvious, but it could be more important if it wasn't Legos. Identifying that we were working in a grid of rows and columns was important, although modified because it was modified when I was teaching rather than observing, because I saw that while one person might decide that one's at the bottom versus one person might think that one is at the top. So defining which orientation we're in is really important.
Absolutely. So defining coordinates, orientation, what's top, what's bottom.
Directional terms. Getting consistent directional terms is hard.
Absolutely. But that's something that happens in real life too. When you're trying to direct somebody, okay, your needle needs to go that way, right? So keeping this in mind when you're then teaching your learner in real life. Okay, let's have another thing that somebody took.
Because how hard is it to stand there and try to tell somebody how to do a lumbar puncture? Like, seriously, how many times do you grab the needle? I do all the time still. I shouldn't.
So, one of the questions I had is that the first time round you guys did it, did anybody notice that the actual piece and the one that was being completed, did anybody get mirror images? You guys did? Anybody else? Okay. So why do you think that was? Why did you get mirror images? Right, so I mean, right, because I think when you're actually dictating a procedure through, right, so you're actually doing it according to what's your right and what's your left. And the same thing applies when you're actually doing a procedure. That's why you got a mirror image. But that actually applies for when you're doing a central line. Sometimes you're you're trying to talk somebody through and you're trying to go according to where you are. So like say your learner is over here, you're standing over here, and you're talking them through from your perspective, not necessarily their perspective. And so they will follow your perspective, right? And therefore they will do opposite of what you're asking them to do, which sometimes happens when you're verbalizing it. So just keep that in mind, because it happened many times. I'm like, oh no, not my median, your median, go medial, go that way. So that happens, so just keep that in the back of the mind. And this is very, very true for new faculty and senior residents. When you're actually trying to explain something, that's when you will notice this.
So just very quickly, I'm going to just pop in with these metacognitive moments. So when you are verbalizing a procedure to someone else, if you're doing that in a teachable moment, and if you're doing that in an actual practice environment, so let's say you're teaching someone how to intubate on a model, but you're demonstrating it first and you're verbally giving your expression to your thoughts as you do it, like some of you were doing around the different tables, that's like a cognitive apprenticeship. So there's theory on that, and there's evidence basis for doing that. So just know that that exists. If you want to look up the buzzword, cognitive apprenticeship is a buzzword to look up.
We have one comment over here.
Oh, yeah. We noticed that just the two-way communication was really key in clarifying each step of what we were doing. Made a big difference.
So also known as closed loop?
Closed loop, yep.
And that was one of my observations too, is that the groups that had closed loop, this block goes on top of the red and the yellow, correct? Yes. Okay, that's done. And then they move on to the next thing. Those were the ones that progressed through the multiple. These were very complicated structures. They each had like 12 pieces. So each of those descriptions, it takes a while. And some of the groups were very quick at it, and some of them took a little bit longer. Observers of the stations, if you didn't have a chance to finish, what kinds of things got in the way of that? What was tough about this as a teacher?
One thing that came up with us, I was one of the learners, and one of the things that I mentioned was when it was mentioned that the exercise was to build a house, my mental model was to build a house. And if at the very start of it, it was like, this is not going to look like a typical house, there's going to be staggering off the pieces, then that would be like, oh, okay, so if I'm building it, I might be in a different frame of mind, you know? So almost starting with the end first as a learner might have been helpful.
So I think, to your point, I think that's really useful, except for this is akin to, you know, okay, I'm going to do this airway. It's going to be a slam dunk. It's going to be Melon Potty 1. I got this, right? And then you go in there, and you're like, oh, the fuck, what was that, right? That happens to all of us. So that, like, that sort of cognitive dissonance, that can happen in real life, and that can happen to your learner, because you can be like, oh, that dude, you know, you're like, well, skinny, I can get your airway right now. And you're like, oh, crap, this person has got a really anterior airway. Oh, shoot, now they're hypoxic. But that is a part of procedures, right? That's what happens. Like, yeah, like, you know, 70, 80% of the people will, but like that 10, 20%, they're going to do that to you. So yeah, I mean, that's exactly the point of doing this workshop, is because sometimes it's not how it's supposed to be expected. It's going to go contrary to that, and that proves that point.
Did any group count the number of pieces they had before they got started? Good. Why is that important? Or why might that be important? Yeah, Sarah was really nice and didn't screw with you guys. I don't think anyway. I don't know who did it. Yeah, yeah. Or maybe, did you guys count, did you guys have the same number of red pieces? I mean, maybe we gave you completely different colors, right? So these little things, right, even before the start of the procedure, you could be sabotaged if your learner throws away the sheath.
Yeah.
Or just, you know, like, oh, that wasn't important, you know? And so, you know, that's another part of closed-loop communication, right? Confirming that you have all the pieces that you have, that, you know, everything is ready to go before you get started. And then at the end of the procedure, even though you guys have like, oh, we're done, you know, load off our shoulders, let's turn around and take a look. Maybe before you do that, confirming it, let's go back from, you know, start at square one, let's go through each piece again and make sure we got it right before we say, hey, we're all done, right?
All right, so we've gotten some really good feedback. I think for the sake of time, and so we can get to all of these really cool procedures that we have planned for you, we're going to go ahead and move on, but keep your thoughts about this in the parking lot, because as we teach these procedures basically amongst ourselves to each other, we will get some really great application of what we've already learned. Sorry, you have one last thing over
Yes, so as we phase into the next section of the talk, just to summarize what we've been hearing in those last comments, task deconstruction is going to be something that's a thought when you're teaching procedures, how you decompose a task into its component parts, transparency and what the task is all about, right? Backwards design is another, you know, principle you could leverage. You know, you start at what the learner is supposed to look like at the end and work and build your construction of your session from the, you know, to the beginning. So just think of those as we go forward.